Hello, I'm Pratiksha Bhosle and today's my topic is blood pressure. High blood pressure is a common condition that affects the body's arteries. It also called hypertension. If you have high blood pressure, the force of the blood pushing against the artery was is consistently too high. The heart has to work harder to pump blood. Blood pressure is measured in millimeters of mercury mmHg. In general, hypertension is a blood pressure reading of 130 to 80 millimeters of mercury mmHg or higher. The American College of Cardiology and American Heart Association divide blood pressure into four general categories. Ideal blood pressure is categorized as normal. Normal blood pressure is lower than 120 to 80 millimeter per mmHg per mmHg. Elevated blood pressure, the top number ranges from 120 to 129 mmHg and the bottom number is below not above 80 mmHg. Stage 1 hypertension, the top number ranges from 130 to 139 mmHg or the bottom number is between 80 to 80 and 89 mmHg. Stage 2 hypertension, the top number is 140 mmHg or higher or the bottom number is 19 mmHg or higher. Blood pressure higher than 180 to 120 mmHg is considered a hypertensive emergency or crisis. Seek emergency medical help for anyone with these blood pressure numbers. Untreated high blood pressure increases the risk of the heart attack, stroke, and other serious health problems. It's important to have your blood pressure checked at least every 2 years starting at age 18. Some people need more frequent checks. Healthy lifestyle habits such as not smoking, exercising, and eating well can help prevent and treat high blood pressure. Some people need medicine to treat high blood pressure. The symptoms of high blood pressure. Most people with high blood pressure have no symptoms. Even if blood pressure readings reach dangerously high level, you can have high blood pressure for years without any symptom. A few people with blood pressure may have headache, shortness of breath, nosebleeds. However, these symptoms aren't specific. They usually don't occur until high blood pressure has reached a severe or life-threatening stage. When you blood pressure screening in an important part of a general health care. How often you should get your blood pressure checked depends on your age and overall health. Ask your provider for a blood pressure reading at least every 2 years, starting at age 18 if you are age 40 or older, or you are 18 to 39 with a high risk of high blood pressure. Ask for a blood pressure check every year. Your care provider will likely recommend more frequent readings if you have high blood pressure or other risk factors for heart disease. Children aged 3 and older may have blood pressure measured as a part of their yearly checkup. If you don't regularly see a care provider, you may be able to get a free blood pressure screening at a health resource fair or other location in your community. The causes of blood pressure. The blood pressure is determined by two things: the amount of blood the heart pumps and how hard it is for the blood to move through the arteries. The more blood the heart pumps and the narrower the arteries, the higher the blood pressure. There are two main types of high blood pressure. Primary hypertension, also called essential hypertension. For most adults, there's no identifiable causes of high blood pressure. This type of high blood pressure is called primary hypertension or essential hypertension. It tends to develop gradually over many years. Plaque buildup in the arteries called arteriosclerosis increases the risk of high blood pressure. Secondary hypertension, this type of high blood pressure is caused by an underlying condition. It tends to appear suddenly and cause higher blood pressure than does primary hypertension. Condition and medicines that can lead to secondary hypertension include adrenal gland tumors, blood vessels problem present at birth, also called congenital heart defect. Cough and cold medicines, some pain relievers, birth control pills, and other prescription drugs. Illegal drugs such as cocaine and amphetamines, kidney disease, obstructive sleep apnea, thyroid problems. Sometimes just getting a health checkup cause blood pressure to increase. This is called the white coat hypertension. The risk factor of blood pressure: age, race, family history, obesity, or being overweight. Excessive weight cause changes in the blood vessel, the kidneys, and other parts of the body. These changes often increase blood pressure. Lack of exercise, tobacco use or vaping, too much salt, low potassium level, drinking too much alcohol, stress, pregnancy. High blood pressure is the most common in adults, but kids can have high blood pressure too. High blood pressure in the children may be caused by problem with the kidneys or heart, but for a growing number of kids, high blood pressure is due to lifestyle habits such as an unhealthy diet and lack of exercise. Thank you.